Good afternoon, everyone, and welcome to the College of Behavioral and Community Sciences COVID-19 Town Hall with Dean Serovich. We'll start with a brief update from the Dean on the fall reopening plan. Then we'll open up the Town Hall to questions from faculty and staff. Please use the chat function in Teams to type in your questions, and you can submit questions at any time. So let's get started. Dean Serovich.
Thank you, Patty. Good afternoon, everyone. I hope this finds you all and your loved ones well, safe, staying healthy. Welcome to the 2020-2021 academic year. It promises to be a doozy, I'm sure. I'm glad you could join us this afternoon. I'm going to take some time and talk about two things today. First, I'm going to talk about COVID and just give some high-level overview and take questions. I want to make sure that I'm not talking about things that you already know. I want to get to things that you want to know. And then after that, we'll talk a little bit about the budget. And same thing, I'll give you an overview, and then you can open it up for questions at any time. Before I talk about COVID, I want to direct you, though, to a very important website that is available to you at USF that I really want you to be paying attention to. If you go to the University of South Florida webpage, there's a link on the top there for COVID. And if you hit on that, you'll see three tabs: one for updates, one for FAQs, one for returning to campus, and another one for academic continuity. These sites contain just about everything that you will need to know to get into the fall academic year. If it's not in there, it hasn't been published yet. And there's a few things I know that aren't in there that we'll talk a little bit about, but they should be there, and they should be there soon. So please rely on that. This is about ways of conducting your class. Proctorio, for those of you who have never used it. The FAQs are broken down for students, staff, and for faculty. So this is a great resource for everybody to tap into and utilize. And again, if you can't find it there, then let me know, and we will help you out. So as you know, the university is now, as of this morning, in phase 2 of our opening plans, and we're still scheduled for fall classes to begin August 24th. We have some that will be a hybrid or in-person classes. Most, however, are online. I want to thank those of you who agreed to do hybrid or in-person classes. I know our students appreciate it. I appreciate it. I'm very grateful. There's not many. There's only about 10% of the classes that we offer are going to be hybrid or in person. So I think, again, my gratitude to you for that. When we do open, so now we're in phase 3, so 50% of employees may go back on campus. Each unit has supplied a phase 1 and phase 2 reopening plan. If you don't know if you want to be on that plan, if you don't know if you're on that plan, please see your unit leader. They can tell you whether you're on there or not. If you want to be added, that's fine. If you need to just go on campus, grab a book, you may do so. Phase 2 opens up some of those barriers for us. So when we come back into the classroom on the 24th, for those of you that will be, there will be plenty of sanitary wipes. There will be PPE. Each member of the USF community will receive at least one buff, which is one of those things you put over your head and then you kind of pull it back up. Skiers use it, and then one government issued white mask. So you will have those. We're trying to get those into everybody's offices as soon as possible. If you're on phase 1 or phase 2 plan, they should already be in your office. If you need to come in, you want to pick one up, we'll do our best to get something into your office for you. We're trying not to leave things in public areas because things in public areas tend to grow legs, and this is very valuable material to us. Every unit has been supplied with cleaning materials. You will have to take care of your own personal office. Common areas, the university has stepped up and hired a consultant, a company to come in and do be available to do more cleaning in common areas, doorknobs, bathrooms, things like that. But you'll be responsible for your office. Those materials, if they haven't been delivered to your unit, they will be soon, and your unit leader has decided where those materials and supplies will be stored. Please ask them for where to have access. Again, we're trying not to leave things in public areas. Each area will have a number of spray bottles with solution in it, and towels, paper towels, etc., to clean areas. We have and have not yet distributed yet. Outside each classroom, there will be sanitary wipes for everybody to take care of their own personal space. Wipe it down before, wipe it down afterwards. So those materials, if they probably aren't there yet, because again, it'll be in open public spaces, but they will be by the 24th for each classroom. If you need to come in and take a look, if you're using, you're going to be using the classroom for any part of your class, let us know, and we'll make sure that we have materials there for you. If you need to come in, look at equipment, inspect, make sure everything is what you need and where you need it. Again, let us know. Stefan will make sure that he and the guys will make sure that everything's where, again, you need it to be. We know, as of yesterday, the Hillsborough County Public Schools has decided, probably pretty smartly, to tell you the truth, to keep the kids home for at least another 4 weeks. That's going to impact a number of you. If published in they're in that website that I told you about, and you already should have received this in an email. It's the faculty guidance and advice for fall 2020. In there, I can tell you, I just copied it out today, starting on page 8. It tells you exactly what you need to do if you fall under certain circumstances. It gives direction if you yourself are immunocompromised, if you live with somebody, if you have to take care of children that are going to be home, whatever those situations are, it lists in there what you need to do if you need to be on campus. Now, let me say this, and I should have said it from the very beginning, but if you don't have to be on campus, if your job does not require you to be on campus, and you and your supervisor believe and agree that you're doing a great job from home, please stay there. But if you are involved in any activities that require you to be on campus, then these are the guidelines that you need to follow. And the reason to be on campus is if you're supervising students, and we have students that come back. If you have other obligations in terms of whatever it is in your unit, every job is so different. It's hard to go through and explain for everything. But if it's between really you and your supervisor, whether you need to be there. I encourage nobody to be there 40 hours a week. I'm not going to be there 40 hours a week. When we open, I'll be there quite a bit, but I'm going to stagger my time just like everybody else to keep you and me safe. So that's how I want the thinking that needs to be here. But again, if your job requires you to be there, then starting on page 8, it lays it out very clearly what you need to do, who you need to contact, and who you need to be who you need to be in contact with. So those are what I see are the big issues that I think are impacting for COVID-19 in our reopening for the fall. Let me open it up to questions. Patty?
I'm having some technical difficulties, so I think Dr. Lister is going to be asking the questions.
I can do that, no problem. Dean Serovich, our first question is, please provide as much detail as you can regarding the college's budget holdback planning process.
I will in the second half of this conversation. I want to keep this focused on COVID right now, and in the second part, I will talk as explicitly as I can about the budget.
Okay, well, all the questions so far about budget, so I encourage you to ask some COVID questions, please.
I mean, if you feel like you're up to date on everything and you're feeling comfortable with what's going to happen in the building, just the other thing you need to know, if you do come into the building, because I was in the building yesterday, and the doors are marked exit and entrance. If you leave the atrium and go out into the breezeway, that's going out as an exit. You cannot come back in through that door. You have to go around to the front of the building and come in. Keep your ID card with you to swipe to be able to get into different parts of the building. It's not easy. I'm hoping it'll get easier by the 24th, but right now it's not. And I think I may have mentioned this and maybe not, but in every building there's going to be a disinfectant machine that you can get two, I guess about 6 or 8 ounce bottles, swiping up to a month, swiping your ID card, so that you should have there should be plenty of disinfectant. They look like Coke machines. Ours in our building is outside, like I said, outside the atrium, and I don't think the ones in the other 2 buildings have yet to be installed, but they will be there are 4 ounce bottles. But they'll be there by the 24th.
Dean Serovich, we have a few questions that have come in.
Okay.
First one is there a list of who the unit leaders are?
Your department chairs primarily, and then in our office, it would be myself, Steve Johnson oversees HR, but it's basically you go to your department chair or school director.
Okay, next question. What is the attendance policy for students who are in class? Since I am teaching in class, I have heard that we now need to record everything and almost teach in 3 different ways.
Well, so that's up to you how you choose to teach. If you're choosing a hybrid model, then you would do however it is. There's so many different ways to do hybrid models. So that is however up to you. Students who need to be in the classroom obviously need to attend. This is which brings up another really good point. The university is going to be releasing a 5-step process for dealing with students who arrive without a mask for class. Now, let me say, every instructor who's in the classroom will receive a box of masks to give to students who show up and don't have one. They might have forgotten it. Things happen. I mean, they dropped it somewhere. You can hand it to them. They can put it on. If they don't, then like I said, we're right now going to start training individuals in mediation skills so that you can call somebody and have them come over and deal with that particular student. Your department chairs, school directors, or other unit leaders should have sent an email to you seeing if you were willing to become trained to be a mediator. I know I'm going to train to be a mediator, so that somebody can come to your class and assist you. I've also asked that the chairs and school directors to get a buddy for the first week of class to go with you to the classroom that very first week. Just make sure that if there are problems, you have somebody there with you. If you can't find a buddy, if your chair can't find one for you, I will go with you and make sure that everything goes smoothly. And if you have a disruptive student, I can be there to assist you with that, or somebody who's trained can be there with you. They're trying to have people available all over campus at all different times to be able to come along. But there are so few of our classes that I think if we had just a few people that would agree to be trained, your chair, school director, needs to have your name by the 13th of August. Training will begin the next week by the Ombudsman office, and we're hoping to have again enough people that it won't take long to get somebody to you if we need to get somebody to you. But the students are being told explicitly that it is a violation of academic. It would be considered misconduct if they show up and they don't put a mask on to get in class. They were told that they will be asked to leave, that they cannot stay in the classroom. But again, a 5-step. Right at the last time I heard, the draft was 5 steps that need to be that will be taken for those particular situations. So, like I said, if you're willing to be trained as a mediator, it's all going to be done online. You may just need to be available that first week of classes in your office, and if we need somebody that can go and assist, again, I prefer that we have a buddy with everybody, and that way we just take that whole thing away. But buddies should be trained. So thank you for that. That launched into some other ones.
Okay, next question. Is anyone obligated to be tested for COVID?
Nobody will be obligated. There will be random testing. You should have received an email that said that in order to return, and that's due today, in order to return, you need to fill out a survey. If you think at any point you're going to be on campus this fall, and I mean just even to walk in and pick up a book, you need to fill out that survey. Then as we get closer to the 24th, they're going to be releasing a daily survey that people need to fill out. And they won't let you, I mean, you can't be on campus if you haven't filled out that initial survey. So if you think there's any chance, now if you live in Oregon and you're working, you know, weirdly, then you're not going to be on campus and don't fill it out. It's, you know, but if those people, the rest of you, pretty much most of you should be filling it out. They'll be doing wellness checks every day, and then people will be randomly selected. If you're randomly selected to have a COVID test, the university will notify you where to be, when, and how they're going to do that. Good question.
Okay, next question. Is the information needed to be posted by August 17th need to be in the syllabus?
So there is and if you go to those FAQs, there is a statement that needs to be in the all syllabi. I don't know if there's a date for that, but if there is, just put it in as soon as you possibly can so students see it. I just think it's a good idea. I don't know that there's a deadline for it. If there is, then the 17th works for me.
Mm-hmm. They did just announce that we needed to have information on our courses up by August 17th. So that's very good.
Thank you.
The next question, will the additional plastic glass panels be installed in all areas that are open workstations before August 24th?
That's what I'm told. I was in there yesterday, didn't see anything, but that's what I'm told. And so that's what they've promised. I know they're being installed. It's not unlikely that we would be towards the end of that because they're working, I think, from one end of campus to the other, but that's what I've been told. If you have questions before you come back and you're not sure, ask Stefan, he'll know. Just send him an email. He can tell you whether there's one up in your particular area.
Can you provide guidance on travel requests / approval, like what kinds of work-related travel or mileage we can engage in and be reimbursed for? Thank you.
So my understanding is that work travel is heavily discouraged. We have approved travel that relates to deliverables on some of the grants that we have. There's a paperwork that needs to be completed and signed off by everybody in order for you to do that. Again, talk to your chair or school director. They should know what that looks like. My understanding, again, is that unless there's something dire about it, again, a deliverable would be dire, but if it's just that you want to, the university is not going to allow that. There's no, especially leaving the state, they're just not going to allow that. So what I heard this morning was that there would be no change to the travel policy from phase 1 to phase 2. And so again, if there's a deliverable, if there's something that, you know, it gets something to a school district, it gets something to a community agency, put in a request, say why you're doing it, what you're doing, how far, where you're going, and then that's fine.
Okay, next question. Staff are having issues with swipe cards not working. Will someone be there to let them in?
Stefan, can you answer that?
Yes, so Eric and Alberto are here during the week, Monday to Friday, 8 a.m. to 4 p.m. If you're having issues getting into the MHC building, PCD, or SOC, please reach out to them at 813-230-9839. Again, that's 813-230-9839, and they'll come and let you in.
Let's put that in the Q&A so people see that if somebody can. Thank you, Stefan. By the time the 24th comes around, that shouldn't be as much of a problem. Probably though, my hunch is then you probably may, what may be happening is that you may not be on phase 1 or phase 2 plan. So you might want to talk to your chair school director and see if that's the issue.
Okay, next question. Are we teaching with masks on? I know we have to wear masks, but when lecturing?
Yes, you are required to wear a mask during lecturing. There are, and if you go to the FAQs, there are some instances where if you're standing behind a shield, the last I heard that you could take off your mask to teach, but you had to stay behind the shield at the podium, so you couldn't just kind of wander around. If they're looking at, again, this is why if you're in the class, you really should go into the classroom and take a look at what's there, because there's also been some microphones have been installed. Microphones have been installed in the ceiling to help people that may be logging in to part of the class. So I recommend that you go on campus and take a look at what your classroom is going to look like. But yes, my understanding is if you're not standing behind a shield and you're exposed, that you must have a mask on to teach.
Okay. Next question. Some of us have lots of projects and activities with community partners. We are using virtual meetings, but any guidance on how and when this might change?
If the community partner wants to host you on their facility, then you may do that. You may do so. At this point, USF is saying no in-person meetings on campus, but does not prohibit you to go to a community partner as long as everybody's using safety and and following typical CDC protocols. You're free to do so. You just can't have them on campus. So for example, I had a meeting that people wanted. It was a donation, and they wanted people there, and so we couldn't have it on campus, but I could go to them.
Okay. The next one is a comment, so I'll just read it. It's not a question. I feel very fortunate to be at USF where we are not being bullied into teaching face-to-face when this is not safe. The fact that only 10% of our classes have a live component speaks well to the flexibility and compassion from our leadership. Many colleagues at other universities are in very difficult situations.
Thank you for that comment. Yes, the USF has done really an outstanding job in trying to balance the needs of our students, the needs, especially of our freshmen coming in and our seniors that are leaving, and trying to give them the experience that they hope for in college, and that's the camaraderie and the in-person classes dealing with faculty. But under these difficult conditions, they're not willing they're only willing to push so far. So we've been lucky in CBCS that we've been able to have such a low rate. I don't think other colleges are quite as low, but we've been very successful in navigating those waters. So thank you for that comment.
Okay. Next question. Is there a threshold of positive cases in a class or department or at the university level that would push us back to phase 1, even if the community infection rate is under control, or all of the metrics community-based?
No, they're not all community-based. Obviously, if we see a spike we don't even have to, no one's put a number that you have to have 5 people sick. We're not doing that. But if we do see a trend someplace, obviously, if the infection rate on campus exceeds that of our surrounding community, we'll go back to phase 1. If we see a high number of positive cases on campus in general, again, I don't have a specific number because we don't know even how many people are going to be back there. This is why tracing you and where you go and where you are on campus is so important, so that we can really carefully monitor if people do get sick and be able to find you if you were with somebody else that got sick, and in reverse, find everybody who was around you when you got sick. But I think I know clearly if the rate on campus exceeds the rate in the community, and the rate in the community in that area is very high, unfortunately. I took a look just the other day and it was really high. Or again, we see a spike somewhere, but that's going to be handled on a case-by-case basis. You know, one of the things you probably all seen either on Facebook or in the news that USF is saying, wow, we got all these cases on campus. Well, the fact of the matter is we cared enough to track them. And if you reported them, you became, a number. That's important. It doesn't mean that we have a higher rate than anybody else in the country. It just means that we tracked it. We knew who those people were, where they were at, and we published it. Well, for goodness sake, to get criticized for that seems for me to be pretty ridiculous. So whenever I see people write comments about, wow, that's a really bad environment to work in, it's like, no, we're just being honest about what's going on here and we're reporting it. So we know what it's been like. Every day, it's daily. It's on that website. Daily, they'll say if it's a student, if it's a faculty, if it was a staff. They don't say much more than that. But so we've been tracking it, and we'll know then after the first couple of weeks if we start seeing jumps, and then that will activate the committee. There's a committee to decide on whether we're going back to phase 1 or not. Great questions. Great questions.
Okay, next one. Is the university still planning to close after Thanksgiving?
Yes, we are. When everyone dissipates and they go to their respective families, it's just too much of a risk to bring everybody back. So yes, now classes will resume, but they will resume online, fully online. There will be some activity in the building and in some of the buildings, depending on where you work, but no, everything should pretty much close down after Thanksgiving for on campus. Not the university's not shutting down, but for on campus.
Okay. Will it ever be required to come to campus for work as staff?
Okay, this is let me see if I can put this require. If your job requires you to be on there, then you have to do at least that portion of your job. You can't do it from home. You can't, clean lab. You can't do lab work from home. Lab work requires that you be on campus. So that portion, at least of your job, would have to be done on campus. If you can't do it, then again, I refer you back to page 8 of the faculty guidance and advice for 2020. So it's not and read. So there are certain jobs and certain people with certain jobs that you have to do it on campus. It's not that you have to come back 40 hours a week, but you just can't do it remotely. So under those requirements, then you would have to come in and then you refer to these guidelines in terms of how to negotiate that. And then somebody has to do the job, right? I mean, if we think about lab work, somebody has to run those labs. And again, there's so many different, somebody has to, if we have students, somebody has to supervise them. We can't just let them sit around. The mail has to go out. Things have to be done that are on campus. And so we think about, like Eric and Alberto, we had to have people, their jobs required to be on campus because we had to have computers turned on. We had to have people letting in our security people to check the building. We had to let them let people into classrooms to put in microphones. Those types of jobs can't be remote. So it depends on the job that you have.
Okay. Is there a set response for students who get COVID in terms of missed assignments, etc.? In other words, are we supposed to give them as much time as they need to complete assignments? Should we be giving them an incomplete? Is there a set and consistent plan for this type of situation so that all faculty are on the same page?
Yes. And again, in the FAQs, in the faculty FAQ, and I read it unfortunately, I didn't read it today. I'm reading a lot of things today, try to be on top of everything, but the old stuff I hadn't really read. My understanding is that if a student gets sick, we need to be accommodating of them. If they just need to be isolated, if they're asymptomatic and they just need to be isolated, we need to find a way to get them the material remotely. So we have to work with them in that regard. So if someone's in quarantine, we have to find a way of doing that. But it depends on the class. So when you say, is there a set, it depends on the class and the nature of the work that has to be done. And so we do have to accommodate, we have to do the best that we can to be able to help that student. Please talk to the advisors, please talk to your department chair, school director, reach out, and Innovative Education is ready to help you in terms of helping those students get something online. But there are some suggestions and there are some recommendations in the FAQs for faculty regarding students who become ill or they test and can't and need to stay in quarantine at least until they get the test results back.
Okay.
Lead this from your heart. Lead this effort from your heart. I mean, that's the best advice I can give you. Just lead it from your heart. Do what you think is right.
Okay, next question. Will guidance be provided about how to work with students in online classes who become COVID positive or have disruption in their lives related to COVID? Thank you.
Yeah,
very similar.
Yes, there is. And again, if you go back to the FAQs, and if it's not specific enough for you, please let your chair or director know, and we can get more. But there is, and again, we're trying to. The Innovative Education is working on ways to be able to help those students access the materials and they will help you on a dime. They will help you, as soon as they possibly can. But you should also be, prepared for that to happen and be thinking now about, okay, if somebody does get ill, how am I going to help now? So if they're ill and they're hospitalized, I mean, there's a difference between asymptomatic ill and being hospitalized. And so it depends on, where the student lies in the continuum. It depends on the nature of your class. But again, be as flexible as you possibly can. Reach out to Innovative Education. And there's trainings going on now. There was an email went out, I think it was this morning Wednesday. Talking about a bunch of trainings that are going to be happening online starting, I think, next week. So please avail yourself of those. They don't take very long. My understanding is some of them are outstanding. And so, please consider doing that now so you can get you thinking about how to get this done. There is also tips there on how to remove a disruptive student from a team's class. So if you're teaching a class, you got a disruptive student, there are specific guidelines on how to remove them from the team's software and eject them from this class. It's pretty cool.
Okay, next one. What will be the cleaning process for restrooms once we start to return? The lack of cleaning was a serious issue before we left.
Right. So class, there should be an increase in cleaning of bathrooms. We should see that. We've been promised that. High touch areas, all of the general areas, atrium, doorknobs, that all should be, we should see more people like we did towards the end before we left. We should see more people in the building doing that kind of work. Bathrooms should get more attention than what they have been in the past. I don't know to what degree that will look like, but we're going to monitor that very carefully.
Next question. If I am teaching a face-to-face class and a student does not want to be on campus, can I expect the student to participate synchronously from home?
They don't want to be on campus and they should not have signed up for your class. Bottom line. So if they need the class and what you're saying is that it's a required class or something that they absolutely need, and they want to take that class, I don't know that you're required. No one's requiring you to do it synchronously. If you want to record and have it sent to them, I don't see a problem with that. But I think Innovative Education may be able to help you with that before that problem even begins. So you might want to seek out some information. And again, they've got so much stuff on their website. I'm sure you could find something pretty easily. If it becomes a problem, again, let your school director know and let me know, and I can get with InEd.
Next question. Presumably, classrooms will be stocked for the students and faculty who will invariably show up having forgotten their masks.
Yes.
Yes.
You'll receive, I think, 100 masks if you're teaching on campus. I mean, it's really a lot. Now, what we want you to do, though, is we don't want you supplying everybody in the classroom a mask every time they come to class. So if we find there's a problematic student who always forgets, this is only for if they forgot it, if they lost it, it dropped as they were getting off the bus, whatever might happen. We know, I mean, that most of them are, are 20-year-olds, 18-year-olds. So in that case, you will be given a good supply of masks to take to the classroom and hand them one. But if again, one student every time never has a mask, that's a student conduct issue. And we will take that over to student rights and responsibilities.
Next, can staff choose to work from home permanently?
No. Okay, we haven't talked about anything permanent. We're so worried about the 24th, to be very honest, that has not even come up. There's so many pressing issues. I shouldn't say no, I should say I don't know. I think it's a lot of this is we have people who have worked remotely. It's really between you and your supervisor. I don't think that just hasn't been discussed yet. Again, there's so many other pressing issues. Talk to your supervisor.
Okay, next one. If our return to campus is on a flexible, intermittent schedule, does the daily health check need to be done daily? The initial email suggested it would just be the days we would be coming to campus.
To the best of my knowledge, that has not changed. I don't think they need, but it could. My understanding, and again, as we get into this, expect changes, expect lots of changes, expect things to change all the time. I do. Every day I wake up, what's going to change today? It's got to be something. Just expect it. It's going to happen. So right now, I think it's just the days that you're going to be on campus, but that could change.
Okay. How will we know if we are cleared to come on campus on a daily basis? What if your permission changes based on the survey you complete?
Yeah, I haven't even seen the survey yet, to be very honest. I don't think it's done yet. So my understanding from an email that I received what's today? Oh, today's Friday, could have been earlier this week. Not just recently, that said that we will be seeing this soon. So I can't answer that question yet. I think that is still being worked out. So I don't even know how I'm going to be notified yet.
Okay. The next one is just a comment. Someone's having a little bit of trouble hearing because of the buffering and it's choppy, so they're hoping it's recorded, and it is.
Okay.
Next, who will be monitoring if people coming to campus are approved to do so?
My understanding is that when you fill out that survey, it pre-populates something that will notify you that maybe you need to get tested, or that you're cleared to come in. So I think it's going to be all automated. I don't think there's going to be a person sitting there reading all this stuff and assessing it. I think it's going to be, if you say yes, yes, yes to 5 different questions and no to 2, then you may be suggested to go in this direction. So it's a decision tree. That's my understanding. But again, until I see it, until I read anything more about it, I can't answer quite that question. But the committee that led by Donna Peterson has been working on this a lot. And they designed, I saw some initial questions that they were utilizing. And so they're setting up this decision tree, which is my understanding how it's going to run.
Okay, next one. What we have heard is that even for entirely on-campus classes, not hybrids, students can decide they do not feel comfortable attending, and the instructor will need to allow them to attend virtually or watch recorded classes. If this is true, will a tech person be available to ensure this is feasible?
So you're going to have a couple options. And again, every online class that's hybrid, we're hiring students that are tech savvy to be with you in the classroom, to be able to assist you during your class. That's all they're there to do, is the technology piece of it. And so BCS, we had to hire 9. And the question came up about whether we've got them or not, but they are there to make sure that they will be trained to make sure the technology works, make corrective actions, and take care of all of that for you. You don't have to worry about it. That's what I hear.
Okay. The next one is a shout out. Please give a shout out to the great work that Eric, Roberto, and others did over the break. I think it's Alberto, not Roberto, did over the break to help faculty with issues and computer outages.
They did an outstanding job, didn't they? I mean, I know my computer went down and Eric had it back up within 15 minutes. It was just incredible. So yes, a big shout out to those guys. They did a tremendous job. They were there every day. They, just relentless in making sure that you could do your job from home. And again, we're doing everything to keep them safe as well. But no, they did an outstanding job. I saw them yesterday. I thanked them both. You can't say enough about those guys. All 3 of them, really. Stefan was there a lot as well. I don't need to leave him out either. All 3 of those guys just did a tremendous job getting people in and out of our classrooms, getting people in and out of different areas of the building, getting that rat caught up on the 2nd floor back in Mario's area. Yeah, I mean, they did a great job. So thank all 3 of them.
Hear, hear. Next one, what happens if when a student in a face-to-face class becomes COVID positive?
Yes, so that needs to be reported to the university, that same email address, the Global Health that others of you have been utilizing, and you turn it over to them. Or Joe Puccio at Student Wellness can be contacted. It's probably better for students. If it's a student, probably needs to go to Joe Puccio. And Student Wellness, they will take it from there. If people need to be contacted, they'll do the contacting. To the best of my knowledge, nothing should fall on you as an instructor.
Okay, next one.
I guess if there is, if you need to isolate, they'll tell you that. We've had a number of cases of people who have been exposed to somebody, and the university has decided that the exposure level was so low that they didn't need to self-isolate. But the university makes a decision, nobody else. Thank you.
Sure. How do you get permission to view the classroom? I would just let Stefan, Eric, or Alberto know that you're going in to view the classroom. You're fine. You can go in. Okay. If you wear a face shield, still need a mask when lecturing?
Really good question, and that has evolved over time, and I can't say that I know right now. We will find that out. I would imagine it's on one of those FAQs, but I haven't seen anything recently. Initially, I can say this, initially it was no, but then there was some change to that, I think. That's a really good question, and we'll have to find that out.
I see a note from Stefan, mask still required with shield, but we're also going to check with Cindy DeLuca, so we'll get an answer. Okay.
Just make sure we know who to get that to. Or we can put it up on the, we can put it in communique.
We can.
So everybody sees it.
And this person actually identified themselves in the Q&A, so we can actually reach out. Okay.
Right. We'll put it in communique as well, so everyone knows.
Next one, I'm teaching a hybrid course with labs in the second half of the semester. Students will be asked to come to campus for 3 labs practice sessions each. I have already been contacted by a student in Colorado asking if he is required to come on campus or can do those online, not for reasons related to COVID. Can we require any student to be available for in-class sessions? If some students would be excused, i.e. caring for a sick family member, can students just elect not to be present for any reason or some unknown reason?
Boy, your questions are getting tougher and tougher as we go along. We need to move to budget here soon. I don't know. I mean, that's really interesting. I would imagine, you know, we have a lot of international students who can't get here. And I know we've been asked to do as much as we possibly can to help that out. But so they're probably facing this more over in engineering than in arts and sciences than we are. So again, I will ask to get some information about that and get something to you. Do we have a name on that too?
No, that one's anonymous, but
that's a really unusual. That's an anomaly. Maybe it's not an anomaly. I guess with our international students, I don't know how that's being handled with them. Mm-hmm. So we'll put something again in communicate. It's a really good question.
Okay. The next one, it says, I've taken some of the Atlee Friday sessions and heard that we cannot require students to be present on video as long as they are present. I have concerns about students who may be online but doing other things, i.e. driving, etc., and not really present and participating. How do we address students who routinely phone in, etc., to class meetings?
This has to be the last question I take on this. I don't have a pat answer. I don't know. We haven't, again, these things just haven't come up. The only thing I can say is, you know, if that's how a student wants to learn, that's how they want to learn. We can't force them to be in front of a computer. If that's how they think that they're going to learn best and they pass and they do okay, that's not on us. That's really on them. You know, students, I just don't know that we can, you know, force that to happen. The only thing I get concerned about would be cheating, whether they're having somebody else do. But when it comes down to the test, Proctorio, they can't. I mean, they have to be present, the ID and all that kind of stuff. So if a student, that's how a student wants to learn. You know, students download podcasts all the time. They they take their classes by listening on a bus. You know, I don't know that we can really, or that we really should. You know, these are young adults. They're figuring their way out in college. That's my response to it.
Okay, and the next one's about random testing. Will the random testing be based on how much time you spend on campus? For instance, will it be more likely that someone who is on campus more often be selected for testing than someone who is only on campus a couple of times a month?
You know, that is really not my understanding, but I don't know. I think it's just going to be a random of those people who have been on campus. Great question, and that has not been discussed. It's just been purely random is all we've been talking. That's all that's been discussed with us. That stuff I think will become clearer as we get a little bit closer yet. Because again, a lot of that monitoring and testing stuff is just now being formulated and figured out.
Do we need to move on to budget?
We can do that. Yeah, I guess we only have 40 minutes left. Okay, thank you for those great questions. And I'm sorry that you guys have some really unique situations out there. And thank you for all the work that you do. Thank you for being as flexible as you have been. And I know that you'll need to be as we move into the fall. Again, we're just going to have to do the best that we can and bring questions to our attention. Bring it to your chair, school director, and then if they can't get an answer, bring it to the dean's office and we'll help. So budget, yeah, so COVID has really done a number on the state budget. And, It's been a difficult process for everybody, right? You know, I mean, this is the whole balancing of getting businesses back up and running, so tax revenue is increased versus keeping people at home and keeping them, you know, safe and unexposed. So, but we do know that that the state has been experiencing tremendous lack of revenue coming in and reduced tax revenue. So the budget that was passed for the universities was passed and signed off by the governor on the 28th or whatever, June 29th, 30th, and went into effect. The governor can't change that unless you have legislatures come back and revamp the budget. And right now, it's just not possible to be able to do that. So what he's done is he's asked all state agencies to hold back a percentage of their budget that's been allocated. So we've got our budget allocated, but we have to hold back. He asked for 6%. Now, only 2/3 of our budget comes directly from the state. The rest comes from tuition, other fees, other things that we might receive. So because of that, we're holding back 4%. Every academic, every college, every area in the academic affairs side and medicine hold back 4%. We can't spend it. They can't take it yet because they haven't come back to do anything about it. So we've been asked to hold back. Luckily, in our college, the dean, my office, has been able to cover that entire 4%. I've not asked anything of the units at all. I've asked nothing. I've taken nothing held back nothing from them. The Board of Governors has asked us now, come back, and said, we want you to start a planning process to hold back more and to predict greater cuts in the future. So for this academic year, we have to come up with another 1% holdback to our budget. And then over the next 2 years, we have to do an exercise. It's an exercise of planning for 10, 12, 12.5, and 15% possible cuts to our budgets. It's an exercise. As you might anticipate, this is a daunting task and it has to be in by next Friday. And we found out about it just we just got the paperwork yesterday, and the paperwork isn't even right, so they have to give it back to us. So this is a very speedy, very quick exercise. I spoke with the president last night in a meeting, and I asked him, I said, okay, this is cutting major things. You're asking me to do this in a week. So if I put something in there, is it really going to get cut, or can I change it? Can I move things around? Maybe we get an influx of a big donor who gives us money. Can I take that money back? You know, can we have some flexibility here? And he said yes. So basically, we're going to propose up to 15% cut to our budget as an exercise. There is not going to be an across the board cut to anybody. So what the administration is saying is that we want you to put it in reserve. We want you to tell us what the impact is going to be of that cut. We want to know who would be impacted by that cut. And then they are going to decide. There's a group of 5, the president, the provost, dean of medicine, because he's kind of the provost of medicine, David Lechner, and Nick Trevich. They're basically going to be deciding what are we going to accept, what they're going to accept as a cut and what they're not. Now we go to 15%, it's so high. I mean, it's just, it blows my mind. It's like for us over like $3 million. Steve and I started working and I'll be talking to the chairs over the weekend or on Monday, maybe even tonight. But it's just an exercise at this point in time. If anything should come to fruition, we're going to work really closely with the chairs to find out, is there something else we can do? Is there something else that we can cut in order to move forward there without having to cut people? There is a discussion of maybe having early retirements. There's discussions, well, all kinds of things that are possibilities. And as the president has said, everything's on the table, everything. And so it's only up to our creativity. It's up to us to do, although it's really hard to be creative within a week. So we're going to put something up there. Again, I'm going to consult with the chairs. I'm going to ask them very tough questions, very tough. And we're going to make very tough decisions, but it doesn't mean that those decisions are going to happen. It's an exercise at this point in time, and those decisions could change. So in a way, I'm not taking this too serious. I mean, I'm taking it very seriously, but in a way I'm not, because we have to get this done in 2 years. So much changes by the day, let alone where are we going to be at in 2 years from now? It would have to take in effect if this has to happen in 2022, June of 2022. Now, the other thing is the cut is above and beyond really, the exercise is a cut above and beyond what the university really needs at this point. Now, if the budget continues to tank, then they may need all of it. But if they don't, they're committed to redirecting resources. So redirecting towards other schools away from different places. So that is where we're at right now. I see it as so fluid that it's hard to even wrap your head around, and it's so uncertain. Again, theoretically, the provost, the president, the group of 5 could say they're taking nothing from one particular college and getting rid of another. They could do that. I mean, so we're going to put in our plan, and we're going to keep an eye on it, and we're going to do everything we can to save people's jobs. So let me open it up for questions.
I think you answered the first two. One was about giving as much detail as you could, and the other one was about when final budget decisions will be made. Right.
Okay. Yeah. So, when the legislature comes back, they will address that 4% or 5%. The BOG will make their decisions around some of the remaining, and then the exercises, again, as of this point, are just exercises.
I don't see any other budget questions as of now. We still have other fall semester related questions if we need to go back to those.
That'd be great. And while people think about this, I mean, this is a lot to digest. I get it. It was hard for me to digest. I found out like last Friday when this was first floated out, and the whole weekend it was just trying to digest the whole thing, comprehend what does this mean? What does it mean for the college? So go ahead, Patty. You can go to other questions.
Sure. The decisions about face-to-face versus online happened in June when the number of cases were different. Can we as faculty modify a face-to-face to a hybrid class or split attendance course?
My understanding is that the provost is no longer accepting changes. Jen, is that your understanding as well?
That is absolutely my understanding. You're right on. Yep.
And you're right. It did happen. And again, let's talk about change. It's constant. But he's decided that if those who committed in June, that's how you're going to offer the class.
And he's coming from a place where he's thinking of the students who have committed to housing, committed to apartments, and so he's trying to honor what information they use to make those decisions.
And accepting a class and deciding on a class. We do have students who really want that in-class experience. They want to be in the classroom. They're just passionate about it.
Okay, next question related to parking permits. How will parking permits work in the fall for those who only come on campus intermittently?
Yeah, boy, you know what? That again hasn't come up yet. I just know that if you haven't, if you did your parking pass like over time, you know, to get had taken out of your payroll deduction, I know it stopped there in probably in March or April, and I have not heard a word, not a peep about this since. I do not think a decision has been made yet about that. So hang on to that question and we'll wait and see. If I hear anything, we'll put something in communique. Please watch communique for updates. I'm going to start pointing you to things, but I haven't heard anything about parking passes yet.
They are on sale online.
Yes.
I think today is the last day of the 2019-20 academic year, so new parking passes will be needed on Monday.
Thank you.
Next question is, when will the winter break schedule be released?
I think it already has, hasn't it? I think
so.
Yeah, I think it came out with the fall schedule. You mean you don't? Yeah. The over winter break. That's already. I think that's already came out with the last schedule.
Do they mean those floating holidays?
They mean the floating holidays.
Ah. For faculty and staff.
That's usually much later.
I'm sorry?
It's the floating holidays that the president usually.
Oh, I'm sorry. Oh, I'm sorry. Again, I can't think past the next week, so I'm not thinking. Yes, no, nothing's been said about that. Nothing has been said. I don't know.
Okay, next question.
Thank you for clarifying that, team. Because I have no idea. I wasn't getting that piece of it. Sorry.
For staff who are not part of phase 2, but unsure of their status in phase 3, even if the university enters into phase 3, will we be granted flexibility if we have issues related to dependent care scheduling and have proven our ability to work remotely?
That's my understanding. Again, but you know, I mean, that's my understanding as of right now. Yes. Yes. But and I have to take a look at phase 3 again, but that's my understanding. Thank you.
Okay, a few budget questions.
Yes.
Can funds still be spent on holdbacks until they are needed?
Excuse me, just 1 second. Dean Serovich, they're reporting, I'm getting a few reports that people can't hear you.
Can you guys hear me?
I can hear you.
Need to talk louder? I can talk louder. I don't know what to do here. Is there something I need to do?
Maybe just get closer to the microphone.
All right. I turned up I don't know if the speaker headphone really helps anything, but that's better. They can hear me better now? All right. Thank you for pointing that out. I want you to be able to hear me. And now I've lost the question.
Can funds still be spent on holdbacks until they are needed?
No, we cannot. No. Now, again, nothing's come out of the units for that. That right now, the 4% is just in my office. And then if indeed it goes that we have to go into the units, then we will pull it out and hold it separately and under a certain code. What we can do is move the type of data of money that's in there. So for right now, what we've done is we've taken, this is all recurring money. They don't want cash. Cash is not useless to them, but they need recurring. So what we've done is we've taken, and we have two types of recurring cash. We have one recurring money, one that's rate for lines, and one that's rate for non-lines. So for the copier, for travel, for computers, we put, of that 4%, 70% of it is coming from the non-salary lines, the non-salary money that we have. I'm betting on the fact that in the next 2 years, we're not going to be doing as much copying as we have in the past. I think it's probably a pretty good bet. I'm betting on the fact that we're probably not going to be doing the kind of travel we were doing. We're not going to be needing things in the office like we were before. So 70% of that, of our 4% cut is that. The other 30% is lines, you know, our faculty and staff rate. So I'm trying to save and preserve as much of that rate as I possibly can. When we get to 15%, forget it, it's gone. But as we do the incremental increases in the exercise, I'm going to try to hold on to as much faculty rate as I possibly can get my hands on and use other monies to be able to buy computers and travel and do the copiers and do whatever else that we need. So right now, that's the strategy that the college is employing. That's only going to hold on for so long, but we don't know yet. And Steve's working the numbers for me to let me know how deep is the cut before we run out of all that rate, and how far do we need to go into the units to be able to meet that that percentage.
Next question. Will the budget cuts have an impact on grad student tuition waivers?
The only thing I can say is this. I'm trying not to, but I'm going to be more insistent that grad waivers should be for PhD students. Master's students should not be given grad waivers. If it's research, I understand that some companies, some units, organizations won't give tuition waivers for research, and you want to attract the best, but I'm going to be very stingy on that because it's lost revenue to the college. That's what it is. And right now we're bleeding money in other ways. And so if that's one way that we can patch a little bit, I'm going to be very stringent. I have to. It's not that I don't support you. It's not that I don't want to. It's what we have to do, and what just to be able to get through all of this.
Next question. Will SCH be a huge factor in cuts? And I should just say SCH stands for student credit hours.
I'm not exactly sure what the question means. I mean, if we generate, it's got nothing to do. No longer is SCH tied to a college's budget. There for a while it did. If you recall, back in, I think it was like 15, 16, somewhere around there, we got half of the money, tuition dollars that were generated above and beyond the year before. That doesn't exist anymore. That money's still in our permanent budget, but we don't get that anymore. It's the university has to be able to make its SCH. And right now, headcount isn't too bad. SCH isn't too terribly bad. We're down just a little bit from last year. It's more a matter of, will the students walk in the door at the last minute, especially if all their classes are online. So SCH has something to do with the overall university budget, but it does not pertain to ours. What we get, our distribution is what we get, and that's what we have to take those our cuts from, or propose our cuts from.
Next question. Can CBCS possibly reduce its budget by a proposed 15% without cutting units?
I don't think that we'll have to cut units. We may have to cut programs. We may have to cut services, but we haven't. We're just starting to get into that that exercise right now. So I don't know that units will have to go or proposed. Just be proposed. And I don't know that they would accept it. I mean, our units are some of the best in the university. If you look at national rankings, and believe me, I'm going to be touting those national rankings out there. You know, you got social work, audiology, speech language pathology, rehab, mental health counseling. Man, those are flags on my back that I'm going to be carrying on this. And so that's going to help us somewhat. So I'm hoping not. Maybe there may be a program here or there that we may have to put out there. There may be services that we are currently offering that we may not be able to offer. It's just a matter of, and I've talked with the chairs, and I'll talk to them again either this weekend or early next week about what do we have to stop doing. That's E&G based. Now let me say, if you're funded by a grant, this is not going to impact you. If you're 100% funded on a grant, that grant is supporting you. E&G and the university is not supporting you. You're fine. As long as that grant is fine and they want to keep you in that position, you're fine. It's those that are on E&G university funding that are at risk at this point.
Next question. Can resources be cut from the branch campuses?
So here's the fun part. So the branch campuses control their own budgets. The interesting piece is that they are supposed to work with us, with me, if they're going to cut anything that impacts any of the units now that are now in CBCS. They're supposed to work with me on that. And again, we're all just blindsided by this. It's coming at us so fast that I haven't heard from them, and I don't know what they're going to do. Now, here's the other thing, though. This is what's going to help the branch campuses, is they received an influx of money from the state that was not cut by the governor. So I think St. Pete got like 3 or 3.5 million. I think Sarasota and Manatee got like $1 million. They can use that in terms of their piece of all this. So they're kind of in a little bit better of a position than we are, because Tampa didn't get any extra money, but they're supposed to work with me if they're going to cut anything, or with the deans in any unit that they think that they need to cut down there. But again, I haven't heard anything, and I hope I don't hear anything. I don't want to hear anything. We have very strong units.
Next is a comment thanking you for your transparency and appreciating your continued support and leadership. Next question. Will the Dean's office be able to indefinitely cover the initial 4% holdback that is likely to turn into a 4% cut?
That's my plan. That's my plan. If they're going to take it, they're going to take it from the dean's office. And again, this is you know, I know you guys don't like it that I sweep, you know, rate when a faculty member leaves, but I can now use that. And it's a collective. It's from all the units, you know. And right now, that's what I'm using. Only 30% of it gets 70%. So don't come to me for a pencil, because I'm not going to have the money for the pencil. But I'm trying to hold on to that that faculty rate. But right now, the 4% will be covered. It's getting to the additional that I'm going to have some help from the units.
That goes into the next question. If we need to go to the units to help find enough holdback funds, will all units be expected to hold back the same percentage of rate?
At this point, unless there's a compelling reason why not, that's what I am expecting. That's what I am expecting to do. Yes.
And next question, is the college at threat of being placed back into CAS, College of Arts and Sciences, as a result of the Florida budget issues?
That is not my understanding. We had, and you can ask your department chair or school director, we had an outstanding review this year. I mean, outstanding. We ranked some of the best in most of the metrics that we reviewed. And again, they can share those metrics with you. We just kicked it. And there was so little that they had to say about us because we do an outstanding job in this college. Now, I say that knowing that tomorrow they could say, hey, you know, you're gone. I mean, that's the reality of all this stuff. But as strong as we are, our research, the research that we do, the volume of that, they would be really hard pressed to make a good argument and move us back over to CAS. I just don't see that happen. CAS is too big as it is right now. I mean, it's just too big. They've been arguing, as you might recall, there have been arguments made for years about reducing the size of CAS. So no, I don't see that happening. I really don't see that happening.
I don't see any further questions right now.
All right. Well, where are we? We're at 3:15. So we're about towards the end of our time. As it is, right?
There is a nice comment that says, thank you, Dean Serovich. You're a great leader and you are very transparent with providing us all the information. We appreciate your continued support and excellent leadership. I think that's worth saying.
Well, thank you. Let me say that, you know, I feel your anxiety. You know, I know that it's hard not knowing what's going on. And we've done our best to kind of let you have a summer. I said the first day back, you know, I need to talk to you. And and things are changing so rapidly. Like I said, I'll do my best to keep you up to date on what I know as of any given day. But again, please educate yourself, go to the websites, take a look at those FAQs, go on to some of these innovative education lectures and their series. They're teaching things, whatever it is that they're offering now, and just take some time to learn so that you're ready. Be as prepared as you possibly can for anything that might hit at any time as we get back into the fall. Like I said, if you think you're going to be in a position where your job needs to be done on campus, you have supervisory responsibilities, you have whatever, and that you can't do that, please look at that document, talk to Central HR. They will work with you. That's their job. We're not going to be doing it in the college. It'll be Central HR. Again, Section 1 of the Faculty Guidance and Advice for Fall 2020. It's packed full of information, and so is that website. So I hope this has been helpful, and we will keep you as updated as we possibly can over the next few weeks. If I think anything major has changed, we'll pull together another meeting. I know we started this off, we had about 130 some people, so I know that you're interested, and I know that you want to know, and we'll find ways, whatever ways that we need to keep you involved and updated. But you need to take some initiative as well, and I appreciate that you don't place the burden on all the administration. So have a good whatever you can in the next couple of weeks. Stay well, stay healthy, stay safe. You and your families are very valuable to this institution. And, we really want to make sure that when we do come back and we're all back together, that we all are back together. So take good care. Thank you for attending. And I think we can, if there's nothing else, we'll end the session, Patty.